Good morning, guys. We'll be talking about how you can get to have high blood pressure due to pregnancy. We have a lot of women who were very okay, but upon getting pregnant, they develop this high blood pressure, and ever since they've been on a drug called amlodipine and lisinopril. These drugs are actually designed to help bring down your blood pressure to normal level and prevent you from going into stroke. Because sometimes you may have a semi or a normal cardiac attack, and that drug will help you prevent the stroke. Let's not really go. Let me explain something that will actually, make it easier for you guys. This is your liver. hmm? This is your pancreas. This is your gallbladder, and these are stones. A normal healthy person doesn't have stones inside the gallbladder. Why? Because there's this fluid inside that is called bile. Whenever you eat a food that has fats, mm, your body will release this bile to come and break down the food. It's early in the morning, so you can hear the birds. So this your liver produces bile, and it travels from these small roads called canaliculi, and it stays inside this gallbladder and become concentrated. Whenever you eat your food that contains fat, this particular organ squeezes, the gallbladder squeezes and pours out what? The bile to come down and break down your food, especially fat. If you don't eat food that contains real good fat, it will not squeeze out this bile. So now when some people get pregnant, sometimes this stone may have been there ever since because of their bad diet, but some of them don't have it, but they now have the stones because they were eating bad food. If you eat highly processed food, like let's say biscuits, bread that contains all those chemicals, carbonated drinks, cake, cake has all those icing, foods or products that contain high fructose corn syrup, it'll start forming stones here. Yes. So diet can actually form stones here. So how does forming stone here relate to you having high blood pressure? Let me explain something to you. When you eat food that contains carbohydrates, your body converts it into simpler sugars that it can absorb and create energy. Now the problem is you already have a little level of sugar in your body. So the moment you eat on a normal when you're hungry, your sugar level goes down. This is where it should be. So when you eat food that contains carbohydrate and it's too much, the sugar passes the normal level and goes higher. What your body does is your brain tells your pancreas, the sugar in the blood is much. Release what? Insulin. So the pancreas will now release insulin to pass this same road that what? This road is called bile duct. This same road that your bile also passes through. So pancreas will release insulin and the insulin will pass through. And it will come and bring down the sugar. You see how Jehovah designed it? To the normal level. It will not take it lower. It will drop it here. I don't know if you understand. So your insulin will stop here, the normal level. Your blood sugar will stop here, the normal level. Why does the body regulate blood sugar? Why does it bring it down? It's because when you have too much blood sugar in the blood, your blood will become attractive for parasites to come in. Bacteria will come in, worms will come in, bad bacteria will come in. In fact, if your heart is being fed with blood that has sugar, it will start complaining. That's why you notice when you have high blood sugar, my markers are misbehaving. Let me pause the video and get another one. That's why you notice when you have high blood sugar, your heart will start beating very fast. It will tell you guys, there is too much sugar in the blood. There is too much sugar in the blood. That's why you see most people are diabetic. Diabetes means you have too much too much sugar in the blood, and it's not coming down. They always have high BP. So why you don't have high blood pressure is because your pancreas is functioning. This is one of the reasons. It helps regulate blood sugar. So for those who have been eating junk food, those your junk foods will make stones for me, and these stones are called gallstones. I can bet you many people don't even know of gallstones. They've been hearing of kidney stones, but they don't know there is something called gallstones. Why this gallstone form is because of the bad food you eat. And also, if you don't eat food that has fat, this bile will never flow out. It will stay here, become very old, and become very thick. You need to make sure this bile flows at least every day by eating food that contains extra virgin olive oil, eating food that contains fat from meat. Yes, they'll tell you to damage your heart. Don't worry, it's a video for another time. It's not true. Um, Eating food that contains palm oil, not just palm oil, there is that thick part at the bottom of palm oil. That's what you need the most. Whenever you eat food, it makes this one flow out and a new one replaces it. So if you eat junk food, this bile will never flow. It will stay and form into thick stuff called bile sludge. Later it will form stones. Now, when you get pregnant, the embryo increases, the child in your womb increases, and the pressure becomes very strong. So for some people already have these stones here. As far as it has never come out here, you will never have problem. But the moment you get pregnant, the pressure of that child in you presses this gall bladder. It forces one or two of these stones to come out. They now come here and they block this place. Remember, your pancreas and your gallbladder shares the same road called bile duct. When the stone blocks here and you eat food that has high sugar, what happens? Your brain complains there's too much sugar. Your pancreas will now release insulin. But the problem is there is no road for the insulin to pass. So what happens? Your blood sugar continues to stay high because insulin is not available to bring it down. And when the blood sugar stays high, your blood pressure increases. So I just got a call and it actually just, you know, disturbed everything. So if you don't eat food that has much fat for this to flow, to become thick and later form stones. So number one, when this place becomes blocked, pancreas no longer releases insulin that brings the blood sugar down. You develop high blood pressure. High blood pressure can be as a result of little or no insulin. High blood pressure could be as a result of your cells are no longer responding to insulin. That one is a different issue entirely. It's called insulin resistance. That one is a different issue entirely and it can be fixed. So number one, your diet can form stones that will block your insulin. Now these stones won't move on a normal day, but when you get pregnant and your child leans on this gallbladder, the stones will now come down and will block it because something has pressed it and moved the stones out. Now, what you need to do is look for a way to remove this stone, flush it out so that insulin can be coming down. And some people who have this problem notice whenever they eat, the left side of their chest below their left rib causes them pains, especially when they eat food that is rich in carbohydrate. Because this insulin that is being released, if another digestive enzymes, it doesn't just release insulin, it releases other digestive enzymes too. When they don't have a place to go, they return back inside it, they start damaging this place. Yes. So that's the first one. Diet can actually build the stones and block it. Number two, blocked bile duct. Not just because of stone, but when you don't eat food too, still on diet, here becomes thick and it forms. Normally it should flow. Your bile should flow like olive oil, very smooth. But when you don't eat food that contains fats, it stays here and becomes thick. It becomes thick like grease. And when it becomes like grease, it no longer flows again. It blocks the place. So besides stone, bile sludge can block this pancreas. So whenever you eat, your sugar will always stay up. It will never go down. Normally, it is normal for sugar to go up because of high sugar food you eat or high carbohydrate food. The thing is, insulin is what is in charge of keeping it down or keeping it in the middle. When your insulin no longer comes out, you develop high blood pressure. Insulin is not a problem. Pancreas is not a problem. This gallstone is a problem. So your diet can cause it. Blocked bile duct can cause it. Then parasite. There are some people that when they get pregnant, they eat sugary food. Sugary food, what does it do? Sugary food reduces your stomach acid. Processed food reduces your stomach acid. Your stomach acid no longer becomes powerful to kill bacteria or pathogens that come in. So worm and their eggs can actually come in and pass the stomach acid and they will come and live here. There's a particular worm that can live here and here. One is known as liver fluke. When it comes and block this place. Insulin no longer comes out again. It comes and block this place to this road, even the bile, the gallbladder. It comes, it damages the liver. It also lives in the liver. So the kind of sugary food you eat, biscuits, chocolates, carbohydrates, and so on, you eat high level of carbohydrate. You consume carbonated drinks. What happens? Parasite comes in and blocks this. This is number one cause of diabetes and one of the causes of high blood pressure. When this organ has been blocked or the organ is being damaged. So another one is called antibiotics. There are bacteria in your body that are called Lactobacillus acidophilus, Lactobacillus reuteri, these two Lactobacillus acidophilus, Lactobacillus reuteri, and Bifidobacterium. These two are very good, same as this one. This one is in charge of, in fact, all of them are in charge of your immunity. They help you fight pathogens, other bad bacteria. When you take too much antibiotics, you kill this one. This one is in charge of also producing stomach acid. Please do your research. You kill them. So what happens when these good bacteria are dead? Bad bacteria can now move freely with nobody to fight them. These are the ones that control your bad bacteria. They fight them, they kill them, and they allow only some to survive. So when they are dead because you take too much antibiotics, bad bacteria can come, damage your pancreas, damage your gallbladder. So antibiotics too can cause it. Can it be reversed? Yes, don't worry. Another one is mineral and vitamin deficiency. When you get pregnant, your body prioritizes your child. When you get pregnant, your body says your child comes first before you. So if you have low level of magnesium glycinate, potassium, and vitamin D3, your body will take it and give it to your child instead of you. And take note, this magnesium glycinate, this potassium, and even vitamin D3 are in charge of how your heart beats. So when they become very low, your heart starts beating anyhow. Either it beats too fast or too low, but mostly it beats too fast. We have a lot of patients, we have actually given them magnesium glycinate, both the capsule, you need to combine it with capsule and the effervescent tablet. That's what most people don't know. Then with potassium, and even vitamin D3, and their blood pressure fixed itself over a period of, I think, 6 weeks. And they've never taken amlodipine and lisinopril. Take note, before you carry out any of this, consult with your doctor. But most of them will tell you, keep taking your medicine. Ask them, will the medicine cure me? They will tell you no. But you need to be supervised when taking this. That is what we do. That aside, we'll talk about how we can fix this. Infection. Having sex with somebody who has sexually transmitted infection, or your hygiene too, can also cause infection. It goes into the vagina and it moves up to the kidneys. The moment your kidney is no longer doing its job, it becomes inflamed. Your liver now stresses itself to do the job of the liver and to do the job of the kidney. And when the workload becomes too much, the liver breaks down. It no longer produces much bile. It also later on, when it no longer produces much bile, stones will also form. The old one here will become thick. It will also affect the pancreas. Liver has problem, check. Pancreas will also have a problem. And another thing, fatty liver, steal from your diet. When you eat food that contains too much starch, and take note, vegetable oil has the ability to stay in your body for months and even years, and it will not go out. When there are some vegetable oil, in fact, not some, all vegetable oil are dangerous. Your cell finds it very easy to convert olive oil, palm oil into food, into energy, but finds it difficult to convert vegetable oil. So what happens? It saves it. When you eat so much processed sugar, it saves it. Now it saves it under under the skin, your stomach, under your hand, your elbow, like this your hand before your elbow, your buttocks. Later on, when there is no more space, it starts saving it inside your liver. And you develop fatty liver. Check, when people have fatty liver problems, they develop high blood pressure. So another thing that can cause high blood pressure as a pregnant woman is food, which will later lead to fatty liver. So how do you treat it? Remember, since the cause for some people is when they got pregnant, their child came and presses their gallbladder and released some of these stones. They need to look for a way to soften these stones so that I can pass through. They need to look for a way to make this bile that is thick to become very fluid, very smooth, so that it can flow. It will no longer be as thick. It will become as olive oil or even less viscous than olive oil. So what do? You take something to thin your bile or flush out the stones. And what can you use for that? Todka, chanka piedra, olive oil, and even ultra bio. Now, this will thin your bile. This will break the stones. This can break the stone. This will make sure you produce too much bile so that you flush out the stones. You see this? This will fight any parasite that is here. So let's first of all go keto diet to first of all cure this problem. Keto diet to first of all cure fatty liver. Keto diet will also do what? Help with this your blocked bile. Keto diet helps this thing to become thin. But besides that, keto diet makes you lose weight. Keto diet starves, in case you have parasites here, starves it. Remember, I've told you before that worms can come in here and cause damage because you're already eating sugary stuff when you're pregnant. So they can come in here and they live here and have children here. So keto diet can starve them and kill them. But it's not as powerful as keto diet can help burn the fats first so that whatever you take will work. Keto diet will reduce inflammation. So another thing is parasite cleanse. There is this thing we have called Jevanol. It is an oil that is very powerful. It is antibacterial, antiviral, antifungal. You can reach out to us. We will give you. You combine it with what? Clove and garlic. Wherever the parasite is, whether in your intestine, in your liver, in your gallbladder, in your pancreas, in your brain, and even in your heart, it will go there and it will kill it. Now remember, sugar is one of the main cause of high blood pressure for pregnant women because here is blocked. So keto diet will fix your fat, fix it. When you thin the bile, it will push out this stone so that the insulin can now be flowing and be regulating your sugar. When you treat the parasites, in case they are here, they are blocked here, because not just stones, parasites can come here and block here. It will kill them. Now, parasites that you kill may actually stay there and not come out. That is why you need extra virgin. This is cold pressed extra virgin olive oil to flush it out. Don't worry, we'll teach you how to do that one. Not the one they call liver flush. This one will move naturally by itself. Then the last one, okay, this other one, supplements. For parents or mothers who give birth and they've lost magnesium, they need to take magnesium glycinate. Please don't take bisglycinate. It still works, but just look for direct magnesium glycinate. Then look for the capsule one. Then look for magnesium glycinate effervescent tablet. Combine both of them. Potassium supplement, you need potassium too. You only see 99 milligrams, which is not enough. You need at least 1,500 to 1,700 a day. Reach out to us. I'll guide you on how you can actually get this. And my team can actually send charts and videos to help you on how to take this and recover yourself. Besides, you need vitamin D3 and K2. Please don't buy D3 alone. Buy D3 that has K2 combined. And the D3 must be 5,000 IUs, K2 must be 1,500 IUs. In case you can't find this stuff, including this effervescent tablet, reach out to us. We will send them to you. Also, you need to treat infection. In case you had sex and your kidney became infected, and it's because of a bad kidney that you have sugar problems or your liver is now overworked and it's no longer working properly. So what do? You treat the infection. We'll come back again to here. This stuff does not just only treat parasites, it also kills bacteria, virus, fungi. So Jevanol will handle it within 2 to 3 weeks. You also combine it with this. These are natural antibiotics. Why don't we use synthetic? Most people who use synthetic antibiotics, they notice that their tongue becomes white. Yeast grows. There are some bacteria you have that synthetic antibiotics can't work against, so you need to go the natural way. They've treated infection for a very long time and it still doesn't go. Become resistant. And these two can do that. It's actually, what is it called? A probiotic that contains this bacteria. We have them. We have them in capsules and we culture them for 3 to 4 weeks. So in case you were pregnant, you gave birth and you now have high blood pressure, there is hope. Just the first week of being on this program, or let's say first and second week, you will stop using this amlodipine. And you can go for almost 1 full year, 2, 3, 4 years without using it. Then if you're able to repair, in case your pancreas, you develop pancreas problem, that pancreatitis, or stones if we are able to fix all of this, because you need to want to do it and we can guide you. When you're able to fix all of this, your blood pressure is gone. You no longer need this. So guys, what causes high blood pressure due to pregnancy? Your diet, blocked bile duct, parasites, antibiotics, mineral vitamin deficiency, infections, and fatty liver. Infection mostly in the kidney. Keto diet will fix you, thin your bile and flush out the stones. Parasite cleanse, supplement, and treat infection. This will help you. And also intermittent fasting. Some people, when they are pregnant, they eat a lot. You eat around 6, you eat around 9, you eat around 12, you eat around 3, you eat around 5, you eat around 6. Your insulin always stays very high. Let me explain this insulin for you. Let me explain the insulin for you guys. You have a worker. In fact, you have lots of workers in your factory. And you come and you shout, pack this load, put inside the warehouse. They rush, they pack the load, they put inside the warehouse. As they are trying to rest, another truck comes in and you tell them, stand up, pack this load, put inside the warehouse. They pack and they put. They say, but we are tired. Before you know it, another truck comes in and you complain again, pack this load, put inside the warehouse. They do it. And they haven't eaten since morning. Around 2, 3 in the afternoon, you've brought like almost 12 trucks. Along the line, they do what? They become tired and they say, we are not doing it again. You shall pack this stuff, put inside the warehouse. They refuse. Pack this stuff, put inside the warehouse. They refuse. When you eat food that has high sugar, it goes into your blood. Your brain tells your pancreas, release insulin and remove this sugar from the blood into the cells. Your cells will respond. The moment the pancreas releases insulin, your cells will remove the sugar from the blood so that it does not cause problem, and they absorb it. The ones they cannot absorb, they go and save under the skin. The aim is sugar should not be in the blood. Before you know, you eat again around 9. Your brain says, this person has eaten again. No, pancreas, release insulin. Pancreas releases insulin. The cell says, again, they now remove. This insulin means they should remove sugar from the blood so that it does not cause problem. They now remove sugar from the blood, they absorb it. You eat again 12. The brain says, this person has eaten again. No, pancreas release insulin so that they can remove the sugar from the blood. The sugar is too much because of the food. Your cells say, what? They now remove the sugar from the blood again. Insulin is what? The language they listen to. When insulin comes into the blood, it tells them, remove sugar from the blood. So when they've done this over and over and over and over again for days and weeks, and you're always eating every time, you don't allow your body to rest. The cells say, you know what? We are not removing the sugar from the blood again. So when your pancreas releases insulin, they don't answer. Insulin comes to them, they don't even respond. They become insulin resistant. They don't even answer insulin again. So what happens? The sugar remains in the blood. And it becomes very high. You become diabetic. Even if you don't become diabetic, you become what is called pre-diabetic. Before you know it, your heart is now being fed blood that has too much sugar. And the heart will continue to beat very fast. There is too much sugar in this blood, though. This blood is not sweet. There is too much sugar in this blood, though. This blood is not sweet. The moment your cells respond to this insulin to remove the sugar in the blood, your blood pressure will come down. So for people who are insulin resistant will drop a video for you guys. So if you're interested in the program, you can DM us, drop a comment, or you can do it yourself. But you need to make sure you are monitored by a doctor, a physician, or a good nutritionist. Please share. This may save lives.